Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. I'm here for my follow-up appointment after the hernia surgery.
Good morning. I'm glad to see you. How have you been feeling since the surgery?
Pretty good, actually. I've had minimal pain and no problems with the site of the surgery.
That's excellent to hear. Just to ensure we have all your details updated, can you confirm your current medications for me?
Sure. I'm on a couple for blood pressure, one for cholesterol, and I was taking an anticoagulant for the stent I had placed a few years ago.
Do you remember the names of the medications for blood pressure?
I believe one is an ACE inhibitor and the other might be a beta blocker. I'm not too good with names, though.
That's all right. We can check that with your pharmacy later. And the cholesterol medication?
It's one of those statins, I think.
Got it. And regarding the anticoagulant, are you still on clopidogrel?
Yes, that's the one.
Great, thank you. How about any pain medications after your surgery?
They gave me something for the pain, but I only needed it for a few days. It's been fine since then.
I'm glad to hear you're managing well. Now concerning your diet, how have you been managing with the dietary restrictions?
I find it tough to stay away from fast food, but I'm trying. It's just easier sometimes with my schedule.
I understand. It can be challenging. I think a consultation with a dietitian could be helpful for you. They can provide tailored advice and simple meal planning tips that fit your lifestyle.
That sounds good. I could use some help in that area.
Perfect. We'll arrange that. You mentioned ongoing hip pain due to arthritis. Can you tell me more about that?
Yeah, it's mostly in my right hip. It gets worse with certain movements, and by the end of the day, it's pretty sore.
We should keep an eye on that and consider an updated X-ray to see if there have been any changes. We can also discuss additional pain management options.
That would be great. Sometimes it's really uncomfortable.
I'll make a note of that. You also mentioned shortness of breath when exerting yourself. Has there been any change or worsening in this symptom?
It's about the same, mostly when I use the stairs or try to run a bit with my kids.
We should definitely continue to monitor that, especially considering your history of coronary artery disease. Keeping active is good, but let's ensure it's safe for you.
I appreciate that, doctor.
Given your medical history, it would also be wise to schedule some follow-up blood tests. We need to keep an eye on your liver functions, especially due to the hepatitis C in your medications.
Understood. When do we need to do that?
I'd suggest doing it within the next 2 weeks. We'll arrange everything before you leave today. Lastly, how have you been feeling mentally, especially after stopping alcohol?
It's been tough, but I'm managing. No drinking for the past 6 months.
That's very commendable. Given your past and service in the military, it might be beneficial to have a session with a psychologist just to support your mental health and manage any stress.
Maybe you're right. I haven't really talked to anyone about it.
It's important to take care of your mental health just as much as your physical health. We can help arrange that.
Thank you, doctor. I think this was a very thorough checkup.
You're welcome. It's my job to make sure we cover everything. We'll see you back here in about 4 to 6 weeks to review everything. If you have any concerns before then, please don't hesitate to contact us.
Will do. Thanks for all your help today.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having quite a bit of trouble with my CPAP mask lately. My hands get numb, and I can't seem to adjust the straps properly. They gave me a new mask every 3 months, but it's been hard to get it to fit right.
I see. Adjusting to a new mask can indeed be challenging, especially with numbness in your hands. Have you mentioned this issue during your sleep classes or any recent visits?
Yes, I brought it up, but didn't get much help. They just showed me once how to adjust it and expected me to manage on my own after that. But my hands just don't cooperate sometimes, and it's affecting my sleep a lot.
That sounds frustrating. You mentioned your sleep is disrupted. Can you tell me more about what happens when you wake up at night?
Well, I usually wake up around 2:30 or 3:30 a.m. It's like clockwork. Once I'm awake, I just can't go back to sleep. I feel tired during the day, and it's hard to keep up with my exercises and even my yard work.
Has anything helped with your sleep in the past, perhaps when you were prescribed trazodone?
The trazodone did help a bit, but my prescription ran out and I haven't renewed it yet. It wasn't perfect, but I did notice some improvement in how well I rested.
Understood. You also mentioned a mucus buildup that bothers you at night. Could you elaborate on that?
Every morning, I wake up with a lot of mucus at the back of my throat. I always need to clear it out. I don't know if it's the mask or something else, but it's very uncomfortable.
Thank you for sharing that. It's important for us to look into all these factors affecting your sleep. How about your balance issues? You mentioned using the banister more often.
That's right. I've noticed I'm not as steady on my feet as I used to be. I'm worried about falling, although I haven't fallen yet. It feels like I might, especially when I'm climbing stairs or if I have to stand up quickly.
It's good that you're taking precautions. We'll need to investigate this further. About your prostate health, you've had some concerns there as well.
Yes, my family has a history of prostate cancer, and I had a rough experience with an examination before. They used a camera, and it was quite uncomfortable. I'm concerned about my prostate because of my family history, but I'm anxious about going through another exam like that.
I understand your concerns, especially given your family history and past experiences. We'll consider all of this as we plan your care. Let me summarize your current health indicators to make sure we cover everything today. Your blood pressure is stable at 130/85 mm. Heart rate is regular at 72 BPM, and your respiratory rate is normal at 16 breaths per minute. Your oxygen saturation is good at 97% on room air, and your BMI is 28.3 kilograms per millimeter square, which is slightly above the preferred range but manageable with your active lifestyle. Your blood tests are largely within normal limits, including your complete blood count and fasting glucose. Your lipid profile shows total cholesterol at 185 milligrams per deciliter, with LDL 110 milligrams and HDL at 45 milligrams per deciliter. Triglycerides are slightly high at 150 milligrams per deciliter. Your PSA is at 2.4 nanograms per milliliter, which is within the expected range given your age, and your renal function is stable, though we should continue to monitor it. Moving forward, we'll arrange a follow-up with neurology to assess the cause of your balance issues and any possible nerve impingements. We need to revisit the equipment clinic to ensure your CPAP mask is fitted properly and that you're comfortable making adjustments on your own. We'll also conduct routine blood tests to monitor your cholesterol levels, sugar levels, and check prostate health indicators closely. It might be beneficial to discuss your sleep hygiene in more detail and consider revisiting trazodone or a similar medication to help with your sleep continuity and quality. Does that plan sound acceptable to you?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good afternoon, Lisa. I've been reviewing the dietary management protocols for our patients with diabetes. It seems we need to update our approach based on the latest guidelines.
Yes, I agree. The new research emphasizes the importance of individualized meal planning and carb counting. Have you considered integrating more advanced dietary tracking tools?
That's a good point. Implementing a digital tracking system could help patients better manage their glycemic control. We could also offer workshops on how to use these tools effectively.
I think that's a fantastic idea. Additionally, collaborating with our dietitians to provide regular nutritional counseling could further enhance patient outcomes.
Let's set up a meeting with the dietetics team next week to discuss this further. With the right tools and education, we can really make a difference in managing diabetes more effectively.
Now look at question 26.
Welcome everyone to our training session on handling psychiatric emergencies in the emergency department. Today, we'll cover the protocols and intervention strategies for acute cases.
This is crucial, especially considering the rising number of mental health crises we see. I'll start by discussing the signs and symptoms to watch for in patients presenting with psychiatric emergencies.
After that, I'll take you through the steps for safely de-escalating situations and the use of emergency medication when necessary. It's important to ensure both patient and staff safety.
To wrap up, we'll conduct role-playing exercises to practice these techniques. It's essential to feel confident and prepared in these challenging situations.
I look forward to seeing how these strategies will improve our responses and patient care in these critical moments.
Now look at question 27.
Today I consulted with a patient who is struggling with insomnia. She's tried various sleep aids but is still having trouble falling asleep.
That's challenging. Have we looked into her sleep hygiene practices? Things like screen time before bed and room environment can significantly impact sleep quality.
Yes, we discussed minimizing screen exposure and creating a more conducive sleep environment. She's open to trying these adjustments. I also suggested cognitive behavioral therapy for insomnia, CBTI, as a structured approach.
CBTI could be very beneficial. It tackles the underlying thoughts and behaviors that disrupt sleep. Should we refer her to a specialist for this?
I think that would be the next best step. A specialist could tailor the therapy to her specific needs and help her develop healthier sleep habits.
Let's arrange that referral then. It's important she gets the right support to improve her sleep.
Now look at question 28.
In today's team meeting, we need to discuss the management of chronic heart failure, particularly focusing on patient self-monitoring and adherence to medication.
Absolutely. It's critical that our patients understand how to monitor their symptoms and recognize when they need to seek medical attention. Education on medication adherence is also vital.
We should also consider enhancing our follow-up procedures. Perhaps integrating telehealth consultations could help us keep a closer eye on their condition and medication management.
I agree. Telehealth could provide an additional layer of support and make it easier for patients to communicate their concerns or any changes in their condition.
I'll look into setting up a pilot telehealth program for our heart failure patients. It could really make a difference in managing their health more proactively.
That sounds promising. Keeping our patients engaged and informed is key to better health outcomes.
Now look at question 29.
Good afternoon, everyone. Today's discussion focuses on the integration of genetic counseling in routine patient care, particularly for those at risk of hereditary diseases.
That's a critical development. Genetic counseling can guide patients in understanding their risks and the impact on their family, helping them make informed medical and lifestyle decisions.
Indeed, And by utilizing genetic testing, we can provide personalized care plans that potentially prevent or mitigate the onset of hereditary conditions.
It's also important that we ensure our patients' privacy and handle this sensitive information with the utmost care. We need to uphold ethical standards while embracing these advancements.
Absolutely. Let's also consider training more staff in genetic counseling techniques to ensure our team is well prepared to address these complex cases effectively.
Now look at question 30.
In our meeting today, I'd like to address the rise in pediatric asthma cases we've observed this season. It's becoming a significant concern.
Yes, I've noticed that trend. Do we have an updated protocol on environmental assessment and management for these patients?
Not yet, which is something we need to develop. Assessing home and school environments for allergens and irritants can help us tailor more effective management strategies for these young patients.
That's a good point. Additionally, educating parents and teachers about asthma triggers and proper inhaler techniques is crucial.
Indeed, let's organize a series of workshops for parents and school staff. Education is key to managing these cases and preventing emergency visits.
I'll coordinate with the pediatric and community health teams to get these initiatives up and running. It's vital we tackle this proactively.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello, I'm Dr. Lydia Chang from the Center for Advanced Cardiac Research. Today we'll delve into a nuanced and complex topic in healthcare, the interplay between autoimmune diseases and cardiovascular disease, CVD. This intersection represents a critical area of study due to the significant implications for patient management and outcomes. Autoimmune diseases, where the immune system mistakenly attacks the body's own tissues, can affect any part of the body, including the heart and blood vessels. This systemic inflammation often leads to an increased risk of cardiovascular diseases, which remain the leading cause of death globally. Research published in the Journal of the American College of Cardiology highlights that patients with autoimmune conditions, such as rheumatoid arthritis, RA, and systemic lupus erythematosus, SLE, are at a 50% higher risk of developing CVD compared to the general population. A case that illustrates this connection involved a patient named Sophia, a 45-year-old woman diagnosed with systemic sclerosis, an autoimmune disorder characterized by hardened skin and connective tissue. Sophia was referred to a cardiologist after experiencing episodes of severe chest pain and shortness of breath. Further investigation revealed that she had developed pulmonary arterial hypertension, PAH, a common cardiac complication of systemic sclerosis. PAH is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart, leading to right ventricular failure if left untreated. Sophia's treatment plan underscores the complexity of managing such patients. It involved immunosuppressive therapy to control her systemic sclerosis and targeted medications for PAH, including endothelin receptor antagonists and phosphodiesterase 5 inhibitors, which help lower blood pressure in the lungs and improve heart function. Her case required a multidisciplinary approach involving rheumatologists, cardiologists, and pulmonologists to coordinate her care and optimize her treatment outcomes. The pathophysiological mechanisms at play in autoimmune-related CVD primarily involve chronic inflammation and autoantibodies that target cardiovascular tissues. These mechanisms contribute to atherosclerosis, myocarditis, and vascular stiffness, each of which can precipitate or exacerbate CVD. Inflammatory cytokines such as tumor necrosis factor alpha, TNF-I, and interleukin-6, IL-6, are elevated in many autoimmune diseases and are known to play a role in the development of atherosclerosis by promoting the formation of arterial plaques. Given the complexity of these interactions, research is increasingly focusing on identifying biomarkers that can predict cardiovascular risk in patients with autoimmune diseases. For instance, high-sensitivity C-reactive protein, HSCRP, a marker of inflammation, has been shown to be particularly useful in predicting cardiac events in patients with RA. Preventive strategies are also pivotal in this patient population. This includes aggressive management of traditional cardiovascular risk factors such as hypertension, hyperlipidemia, and diabetes. Lifestyle interventions such as smoking cessation, regular exercise, and a heart-healthy diet are universally recommended. Additionally, recent studies suggest that statin therapy not only reduces lipid levels, but also has anti-inflammatory effects that may be beneficial in autoimmune conditions. The relationship between autoimmune diseases and cardiovascular disease is a vivid example of how systemic conditions can profoundly impact heart health. It challenges healthcare professionals to adopt a holistic and integrated approach in managing these patients, emphasizing the importance of early detection, rigorous management of coexisting CVD risk factors, and tailored therapeutic strategies. Ongoing research and collaboration across specialties are essential to further elucidate the mechanisms underlying this association and to develop more effective interventions.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
I am Dr. Michael Richardson, and today I delve into a topic of critical importance in modern medicine, the management of antibiotic resistance in nosocomial infections. The rise of multi-drug resistant organisms, MDROs, in hospital settings not only challenges our treatment capabilities, but also highlights the urgent need for integrated infection control strategies. Let us examine this issue through the lens of a specific case study from a tertiary care hospital. In our case study, patient X, a 65-year-old male with a history of chronic obstructive pulmonary disease, was admitted to the hospital due to acute exacerbation. During his stay, he developed a nosocomial pneumonia caused by Pseudomonas aeruginosa, which was found to be resistant to multiple first-line antibiotics. This situation is not uncommon in hospitals across the globe, where P. aeruginosa and other MDROs, such as MRSA and VRE, present significant treatment challenges. The crux of managing such infections lies in understanding the mechanisms of antibiotic resistance and implementing multifaceted approaches to prevent their spread. Antibiotic stewardship programs, ASPs, are pivotal in this context. These programs ensure the judicious use of antibiotics through protocols that promote the selection of the appropriate antibiotic, dosage, and duration of therapy. In the case of patient X, the ASP team intervened to optimize antimicrobial therapy, shifting from a broad-spectrum antibiotic to a targeted treatment after susceptibility testing. Moreover, environmental cleanliness in healthcare settings plays a crucial role in controlling the spread of MDROs. Regular and thorough cleaning protocols, along with the use of disinfectants effective against MDROs, are vital. For patient X, enhanced cleaning measures were implemented in his and adjacent rooms, significantly reducing the risk of cross-contamination. Hand hygiene, both by healthcare professionals and visitors, cannot be overstressed. Compliance with hand-washing protocols is one of the simplest yet most effective strategies to prevent the transmission of infectious agents. In response to patient X's case, the hospital launched a re-education campaign on hand hygiene, emphasizing its importance through workshops and visual reminders throughout the facility. The deployment of diagnostic advancements also aids in the timely identification of MDROs, allowing for prompt and appropriate treatment decisions. The hospital utilized rapid molecular diagnostic tools to identify the specific resistance genes in P. aeruginosa, which informed the antibiotic selection process, thus tailoring the treatment to effectively combat the pathogen. Patient education about the risks of antibiotic resistance and the importance of adherence to prescribed treatments is another critical element. Educating patients like X about the potential consequences of noncompliance can foster more responsible use of antibiotics, potentially reducing the development of resistance. Furthermore, collaboration between different departments within the hospital is essential. In our case, the infectious disease team, microbiology department, and clinical pharmacists worked together to formulate a treatment and monitoring plan that addressed both the immediate needs of the patient and the broader public health implications. Lastly, the involvement of policymakers in promoting research on antibiotic alternatives, such as bacteriophages, and the development of new antimicrobial agents is crucial for long-term solutions to antibiotic resistance. The case of patient X highlights the complexities and challenges of managing nosocomial infections with antibiotic-resistant organisms. However, it also demonstrates that through comprehensive hospital-based strategies, including antibiotic stewardship, enhanced hygiene practices, rapid diagnostics, patient education, and interdisciplinary collaboration, we can effectively manage and mitigate these challenges.